This has started as a team of very dedicated and interested professionals to make make a difference in public health in Moldova at the beginning. In 2007, the organization has been reorganized to focus on assistance with health policy reforms and in TB and HIV, and not only public health for communicable diseases, but also technical assistance projects, evaluation, and capacity building, and basically trying to make the health system in Moldova as responsible to the needs of key populations and to needs of citizens. And what we are now is a team of 20 people. We are all a mix of people coming from the government and non-government sector with experience and expertise in various areas of public health and health systems. Since 2010, we are principal recipient on the dual-track finance mechanism of the Global Fund for both HIV and TB grants from round 8 and round 9. And for HIV, we have been the principal recipient until 2017, end of 2017. For TB, we continue to be the principal recipient for the TB grants. Also, since 2015, we have applied and received the grant, the regional grant for TB through health system perspective in 11 Eastern Europe and Central Asian countries. And those are Belarus, Ukraine, Moldova, Azerbaijan, Armenia, and Georgia, and Kazakhstan, Kyrgyzstan, Tajikistan, Turkmenistan, and Uzbekistan. So these are the countries where we have been working since 2016 to change the way the TB services are delivered to the people, so that the response to TB is much more effective than it has been in the last decades. At the time when Global Fund has started its implementation in this region, we were in a very difficult and challenging situation. There was basically no HIV treatment. So at the time we had HIV testing, and we had some very small scale prevention programs for HIV, but nearly no HIV treatment. At this point in time, about 50% of the estimated people living with HIV are on treatment, and that's definitely the biggest contribution was due to the Global Fund. Moreover, due to the Global Fund grants in this region, the HIV prevention has been brought to scale in a lot of the countries, and what has been, so to say, the bottleneck is actually connecting the people from key populations to the formal health systems to make them enter the treatment programs. And the other piece that has been successful is once these programs have been established, the treatment programs have been established in the region, the governments have taken over a lot of the treatment and prevention of mother-to-child transmission for HIV. About probably almost 100% of the prevention of mother-to-child transmission is now owned by the countries. And also most of the countries have already taken over the treatment for first-line HIV treatment, whereas Global Fund still contributes significantly to second-line HIV ERT treatment, because this is much more expensive than it was. So, and finally for HIV, the Global Fund has been definitely the one that, so to say, put the key populations at the forefront of the HIV response at the times when governments were not ready to accept that our HIV epidemic is fueled by injecting drug use, by men who have sex with men through unprotected sex, and sex workers. And because of the Global Fund, the outreach to these populations and the coverage has significantly increased. For TB, the situation is that indeed the Eastern Europe and Central Asia region, although is seeing significant reductions in the number of people who are affected by TB in the overall rate, we have a very high burden of multi-drug resistant TB, which is known as MDR TB. And again, because of the Global Fund investments, it was possible to increase access to rapid testing, modern diagnostics for TB, as well as access to TB treatment, especially again second-line TB treatment, which is very expensive. So the current cost per TB patient is in thousands of dollars compared to, just $100 for sensitive TB. So this financial burden, it was very important that the Global Fund has chipped in to help the countries to provide those services. At the same time, a specific problem for this region, Eastern Europe and Central Asia, is that compared to any other region in the world, our TB system is based on long hospitalization. And while the long-term hospitalization has been always considered as a way to deal with the social vulnerabilities of people, to keep them in treatment as long as possible and to make sure that they adhere to this treatment, it was also the cause why we have become the MDR highest burden in the region. Why we have started this regional project in Eastern Europe and Central Asia was exactly because we thought the biggest bottleneck in how the model of TB care is organized, and it was very important to change from hospital-centric model of care to patient-centered model of care, where the needs of the patients are addressed from all the angles, and the patient is able to get through the end of the treatment and get effectively treatment at the end of it. So to speak in indicators, I think for TB, there's a large decrease in incidence in TB overall in the region. There's an increase in the success of treatment, which is very good. However, in MDR TB, there's still need for significant investments and maintaining the investments at the level that they have been done so far. So indeed, this year is an important one for the Global Fund in reaching its replenishment targets, because if it doesn't reach the replenishment targets, the funding not only for Eastern Europe and Central Asia region but around the world will be affected, and it would basically reverse a lot of the gains that have been made. Global Fund has been one of the very successful donors that have shown millions of lives saved and the infections averted. And all the economic analysis done shows that the investments need to be kept at this level or higher in order to ensure that we're not only reaching control of the epidemics but start to end the epidemics. And whereas in malaria there has been significant, for example, worldwide, significant reduction in malaria, and some countries are close to malaria eliminations or have already eliminated malaria. In HIV and TB, we are very far from ending the epidemics. And Eastern Europe and Central Asia is actually the only region in the world where there is still an increasing HIV epidemic. So if the replenishment targets are not reached, and we already are, so to say, a less prioritized region by the Global Fund, and we will see anyway some reduced funding. If these targets are not reached, we will be in even worse place. The assumption based on which the Global Fund works and reduces the investment in the region is that the governments, are strong. They should be committing to their populations to do everything they have committed at the international level, and compared to other regions, they have the means. The problem is that in our region, there's a lot of countries who still struggle to provide sufficient support to their health budgets. And in these conditions, when countries are still not doing well in their health systems, they are doing even worse in providing more resources to their neglected populations and to their vulnerable populations. So support from the Global Fund for key populations and vulnerable populations is very important to ensure that we not even dream to get to ending TB or HIV, but controlling these epidemics at this point in time.